Are you on Citalopram, also known as Celexa? This video looks at side effects, and at the end of the video, 7 must-know tips about Citalopram. Coming up! This channel is about tips and advice to promote your health and to keep you young. And if that's what you want, hit the subscribe button and the notification bell. And a shout out to Nick Homer and his wife. This video is for you. What is Citalopram? Citalopram is also known as Celexa, and it's a prescription medication used to treat the symptoms of depression. It can be used off-label to treat anxiety or obsessive-compulsive disorder. Celexa belongs to a class of drugs called serotonin reuptake inhibitors, SSRIs for short. Celexa is the brand name for Citalopram. How does Citalopram work? Celexa works by increasing the amount of serotonin in your brain. Serotonin is a chemical neurotransmitter which is in your body that helps to regulate mood. It does this by blocking the reabsorption of serotonin into nerve cells, which makes more serotonin available in your brain. Citalopram dosing and administration. So there are different types of tablets. There are 10 milligram, 20 milligram, and 40 milligram tablets. Celexa should be administered at an initial dose of 20 milligrams once daily. If this is tolerated within 1 or 2 weeks, you can increase the dose to maximum 40 milligrams daily. Doses above 40 milligrams daily are not recommended due to the risk of QT prolongation. What does QT prolongation mean? This means it takes longer for your heart muscle to recharge between beats. You would be in an increased risk of heart arrhythmia. The maximum dose for an older adult, and I would say above the age of 60 years old, is 20 milligrams daily. Higher doses would lead to an increased chance of adverse drug reactions. Another group of individuals to be careful with are people who have severe renal disease. How long should you be on this drug? Most people are on this drug for about 6 months on a maintenance dose. This is after the acute treatment for about 4 weeks to 8 weeks. You should start noticing an improvement in your symptoms in a week or 2. However, in most people, it might take up to 4 to 6 weeks for you to feel better. If you do think it might not be helping in a week or 2, do not suddenly stop the medication, do not stop the pill without talking to your doctor. And if you need to be on the drug longer than the 6 to 9 months, please have a discussion with your doctor. Question of the day: are you on Citalopram, and what dose are you on? What are the side effects of Citalopram? The most common side effects of Celexa are GI side effects such as nausea, vomiting and diarrhea, feeling tired, feeling fatigued or drowsy, difficulty concentrating or memory problems, having a headache, difficulty sleeping, erectile dysfunction and loss of an orgasm, changes in weight, fast heart rate, increased sweating and feeling shaky, eye problems, dry eyes, blurred vision and halos around lights, feeling lightheaded, loss of coordination and feeling unsteady, dry mouth, hallucinations and agitation. 7 must-know tips if you're on Citalopram. 1. Is it better to take Citalopram in the morning or at night time? Take Citalopram once a day, and you can take it with or without food. And you can take Citalopram at any time of the day as long as you stick to the same time every day. And if you have trouble sleeping, I would recommend you take it in the morning. Number 2, Citalopram can make you feel less hungry, so you may lose weight when you first start taking it. Later on, you may gain a little weight as your appetite returns. If you start to have problems with your weight while taking Citalopram, talk to your doctor, talk to your pharmacist. Number 3, Citalopram can affect your sodium in your body. If your sodium is too low, you're at an increased chance of a seizure. Ask your doctor once in a while to test for this. Number 4, do not suddenly stop taking Citalopram without talking to your doctor. You may end up with withdrawal symptoms. Number 5, if you have increased problems with bleeding or bruising or unexplained skin changes such as rashes or blisters, talk to your doctor about this. This could be a side effect from this medication. Number 6, If you experience worsening depression or suicidal thoughts while on citalopram, talk to your doctor as soon as possible. Number 7. I advise you not to drink alcohol and citalopram, as it can amplify the side effects of this medication. Contraindications to citalopram. Well, please look at this video I made looking at contraindications for another antidepressant called Lexapro. Both Lexapro and citalopram belong to the same class of drugs called SSRIs. The same contraindications apply to citalopram. And if you're interested in other videos, click right here, or click right here, or click right here. Think your health and have a good day. Hopefully the audio works. People want to know the audio stopped working. So coming up. Tired, feeling fatigued and drowsy. Finished.